In our last video, we discussed blood clots in your legs and lungs and are known as DVT and pulmonary embolism. To recap, we said blood clots in your legs, which is DVT, can dislodge and travel through the deep veins of your legs to your lungs, causing a pulmonary embolism. Pulmonary embolism, remember we said, is fatal. That video will be linked below. Welcome to my channel. My name is Evelyn. Today we discuss the relationship between the blood clots and the long distance travel. The long journeys, more than 4 hours, by plane, bus or car, are thought to have a slightly higher risk of DVT formation. This is thought to be due to sitting cramped and immobile in one place for too long. Blood therefore travels slowly in the vein and is more likely to form a clot. Symptoms of DVT, as discussed in the previous video, include swelling, pain, redness, warmth on the affected limb. The risk of DVT formation after a travel is very small. Research suggests that one person in 4,655 flights that last 4 hours and over develop DVT. The longer the journey, the more likely you are to develop DVT. But a majority of long-distance travelers have no problems unless they have other risk factors that are involved. So for most people, the risk of developing DVT from a long journey is very minimal. So who is at risk of developing DVT? Anyone can develop DVT following long journey, but there are a few conditions that can lead to the development of DVT. The first one is pregnancy. Pregnant women of 6 months and above traveling on long journey are at a high risk of developing DVT. Those having who had previously been diagnosed with PE, with pulmonary embolism or DVT, are at risk of developing DVT on a long journey. Those on combined contraceptive hormone pills, patches or rings, or oral hormone replacement therapy, which otherwise is known as HR, are also at a risk of developing. Obesity is also a predisposing factor for developing DVT on a long flight. Cancer patients who are still on medication, who are undergoing treatment and traveling long journey, are also at risk of developing DVT. Those who have had limb fractures and have plaster cast are also at a risk of developing DVT if they go on a long journey. Anybody who has had recent severe illness like pneumonia, heart failure, or heart attack are also at a high risk of developing DVT. Also, those who have had DVT before and have not been treated are also at a high risk of developing DVT. Those who have had DVT before and are on anticoagulants are at a very minimal risk of developing DVT. Some blood clotting disorders such as thrombophilia are predisposing factors also for developing DVT. Recent surgery, someone who has had major surgery lasting for over half an hour within the last 2 months, are also predisposed of having DVT if they travel on a long journey. So what should you do to prevent DVT on long journey? While you're on a long journey, try to exercise your calf and foot muscles regularly. By every half an hour, you can try and straighten and bend your legs, feet, and toes while seated. Walk up and down the aisle every hour when it is safe to do so. Although this may be beyond your scope, try and get a leg space that way your feet can fit well on a flight, for example, on a long flight, so that you're able to straighten and bend your legs like exercise when you're sitting, and avoid putting things under the front seat. Try and recline your seat if you're on a flight. Also get up when you can and stretch your legs when traveling on a motorbike. If you're traveling on a motor vehicle, try and get out of the motor vehicle and walk about to exercise your legs. Drink enough fluids on the flight to avoid dehydration, which will make your blood sticky, forming blood clots. Also avoid sleeping pills because they make you immobile. Also avoid taking a lot of alcohol because it makes you dehydrated and makes you immobile. So you are predisposed to form blood clots. If you can, wear elastic compression stockings. There is evidence to suggest that these stockings can help prevent travel-related DVT on people who have had moderate or high risk. In 2021, a review quantified this as a reduction in the risk of DVT from about 10 to 30 to 1 to 3 1,000 passengers. so a reduction of 90%, which is very good. You can also buy the stockings from pharmacies, but make sure you get the right ones because there are two types. Those that are made for mobile people who are very mobile, like athletes, medical people who stand for too long. And or the second type is the type for people who are immobile, like the patients who are undergoing surgery, patients who are bedridden, anybody who is not able to move. So those ones are the ones you can buy for a long flight because you're not going to be mobile for too long. The pharmacist should take the girth of your cuff to make sure you get the right size. Please note they come as knee high or above knee. So it is recommended above knee would be the best on long distance flight to avoid the high DVT. These stockings need to be graduated compression stockings with correct amount of compression, which is class 1. The slight pressure from the stocking helps to prevent blood pooling in the cuff. Please note that the stockings do not replace the need for regular exercises, but work concurrently with exercises, like walking around on the flight. Even if you're wearing them, just walk around on the flight, stretch your legs and fold where you're seated. If you have a fracture and planning to travel on a long journey and you have a plaster cast, please consult early enough the fracture clinic so that they're able to advise, and maybe most likely they're going to split the plaster cast before you travel. And also consult your fracture clinic because that is a specialty that the GP in the UK, if you live in the UK, that will not be able to advise you. So it's a specialist area where the specialists will advise you on your travel on a long journey. Then there is anticoagulants, anticoagulant medication. People who are at high risk of developing DVT after a long journey may be advised to have anticoagulants, which are blood thinners, meaning it makes the blood thin, making it less likely to clot. Heparin injection might be given before long travels. The people who fall in this category are like people with thrombophilia, people being treated for cancer, those who have had major surgery in the previous 4 to 8 weeks, especially under general anesthetic for more than 30 minutes. If you have had a hip or knee replacement within 3 months, you should avoid long distance travels completely. If you're in the UK, the GP will not be able to advise you on the use of anticoagulants because this is a specialist issue. So get a specialist opinion before you travel. As we summarize, please note that aspirin is not used to prevent DVT, but is usually used to help prevent the risk of blood clots in the arteries, which can cause stroke and heart attacks. However, aspirin does not seem to be very effective in preventing clots in veins. After the journey, it's advisable that you take a walk to let circulating blood go on. Majority of travelers have no problems. However, if you develop some swollen, painful cuff and breathing difficulty shortly after your long journey, you will need to see a doctor urgently. Slight, painless puffiness of the feet and ankles is common after a long journey and is not due to DVT. We've come to the end of this video. I hope it was helpful to you. If you think it was helpful, please subscribe and share. See you in the next video. Thank you for choosing to watch my video. I've taken time to research, record, and edit. I'm on a mission to educate and pass information to the lay people who have no medical knowledge at all. You choosing to watch my video encourages me to do more research and share the crucial information and knowledge on medical issues. To my followers, thank you so much. You are sincerely appreciated. You are the pillar that keeps me going. You are blessed. If this is your first time here, please subscribe and share. Remember to click on the notification button for future videos.